Hello and welcome once again aboard JulieCity. As always, I'm excited to be here and I'm glad you are here. So if you've been following me, I'm sure you watched my last video and I did mention that the month of November is Global Men's Health Promotion, and in conjunction with Movember, which is a men's health promotion charity. As a health channel, I'm giving you all things about men. And while I was researching, I happened to go to Dr. Google to check out common health questions men ask. And I was surprised to realize that a lot of them were actually around sexual health. And so I decided to get 5 of these questions. So that is why I've titled this video 5 embarrassing health questions men are too scared to ask. So first of all, start by saying that the whole anatomy of an erection is all about blood flow into the penis. So blood flow into the penis causes erection or results in an erection when a man is obviously aroused. And there are so many things that can hinder this. And when this is hindered, of course, the man begins to have a challenge with having an erection. First of all, is anxiety. So mental health plays a huge part. When one is anxious or depressed, it is hard, obviously, to get aroused. So check your stress levels, check your life and see areas that you're feeling stressed and try and cut down on it. If you're so anxious about it, then it can play on your psychic and you begin to have difficulty actually getting physically aroused. Remember to calm down and take deep breaths. When you're too keen to impress, that can actually result in your inability to get aroused as quickly as you want to. So if there's any experience, bad experience, could be trauma, it could be probably abuse from the past, maybe sexual abuse or confidence issue, just think through it and speak to someone if need be, so that all of that can be resolved and you can get back down to business. The other thing, obviously, is blood pressure and diabetes. Yes, those two medical conditions, they are silent killers and they rob people of a lot of things. For men, it could play a part in the sense that the surge of blood to the penis that causes erection becomes impacted, obviously. When this is obstructed by clogged arteries, then there might be a challenge. Another thing I will also mention is medication. Certain medications, especially medications for blood pressure and diabetes, can have huge impact on a man's ability to be aroused. Involve your medical practitioner with regards to your hypertension and blood pressure if you're one that is suffering from either or both. That way, a plan of care will be put in place that will help you manage these conditions. Hopefully, when they are under control, you'll be able to get back down to business. Age is another one that plays a key role. The more one ages, the more things begin to slow down. And if you are previously getting aroused like in a matter of seconds, then you might begin to have challenges with this. Keeping physically active, eating the right kind of diet, and watching your stress level again is one that will actually help you resolve this issue. I know we call them embarrassing or you're too afraid to speak out. Try not to jump into self-medication. If this is something you're experiencing frequently, man up and speak to your doctor. Be brave and they will hopefully find a solution for you to do what you need to do and get back to business. We know that we have a lot of hair follicles around the private parts, yes, including the penis. So it's not unusual to have some irritated hair follicle or a hair follicle that is just exacerbated. However, if you notice any form of oozing leaking, bleeding, pus, whitish patch, or a spot that keeps spreading or expanding, then my best advice will be, please speak to your medical professional. Yes, there's nothing they've not seen. There's nothing they've not heard. There's nothing that is really new under the sun. So man up, I will say again, go in there, speak to your medical professional. Don't die in silence. Remember, if you watch my last video, I did mention that the prognosis for men is poor, not because they can't cope, but that's because they don't speak up quickly, especially for things in the private area. Everyone tends to shy away from it. But please don't die in silence. Go in there and speak to your doctor. There are a few things that can actually lead to this. However, again, as we begin to go older, for men, prostate health can be a challenge. So it's important that if you're finding this difficult, that you speak to your medical practitioner. However, for the purpose of information, there are certain things that can cause one to have problems peeing or have blood in their wee. And some of them are like sexually transmitted infections like STDs and gonorrhea. Some of their symptoms could be difficulty passing urine. The other thing could be nerve damage. Yes, because the nerve sends signal to the brain for an action. And so when the brain is not getting that signal from the nerve that it's time to wee, or that the bladder is full and needs emptying, then one might have problem passing urine. Kidney stones can also interfere with a man's ability to urinate. All of these are things that can hinder a man passing urine. So if you're having problem passing urine, it's important that you do not ignore these signs. I will say it again. The urologist and the gynecologist, there's nothing they have not seen. There's nothing new under the sun. So please, man up. Go in and get checked. When a disease is caught at the early stage, prognosis is usually way better than at the late stage. So please go in and get checked. It's important. It could be something as simple as hemorrhoid, which of course you get pain relief and advice on how to manage it. It could also be constipation, and that is where healthy eating comes in, exercising or staying active day to day comes in, good sleep comes in. All of those work in your digestive system and help you not to be constipated. High fiber food intake, whole grain intake, fresh fruits and vegetables are all healthy options that could keep one away from constipation, because constipation could cause a lot of tear around the rectum or the anus, causing bleeding. Again, colorectal cancer is common among men and is one of the leading cause of cancer deaths in men. And so it's important that you do not ignore this sign or shy away from it, because if it is caught early, then one doesn't have to die from it. The problem about colorectal cancer is the fact that they do present at a later stage. So that is why it's important that you speak to your medical professional. Basically, it's all linked to proper hygiene. Proper hygiene cannot be underestimated, and that could actually lead to why you are feeling itchy, smelly, and sore there. So some of the things that can happen could be, one, of course, you know that the penis has its own lubricant, which you can see at the tip of the penis. Now, if you do not have proper hygiene or particularly take care of that place daily, what can happen there is that this lubricant that is natural, that is meant to keep that place moist, begins to build up. And as it continues to build up, it can lead to this sticky, itchy, smelling, sore situation that you see. So that is why it's important to ensure that proper daily hygiene is observed. Yeah, ensure that your underwear is changed daily and it is clean and dry, because if it is damp, it could also lead to infection. One of the things that can cause a foul smell down there or in the urine could be urinary tract infection. So it's important as well that if you observe daily hygiene and you are the one who is particular about your underpants and you still feel smelly there, then please speak to your doctor, who will look into your particular case and give you particular advice. The prostate gland can become inflamed, and that could lead to the soreness, the pain in your penis, your testicles, and even your anal and lower abdomen. So it's important to get checked out if this pain and soreness becomes persistent. Overall, maintaining a good daily hygiene and using clean, dry underpants, all changed daily, could help prevent smelly, itchy, sore penis. Remember, see your doctor. There are some over-the-counter medications that could help with itching, but like the pharmacist will say, if your symptoms persist after 3 days, see your doctor. So please don't shy away, man. You are a man, come on. Brave up, go in, speak to the doctor so that you can get all the comfort you need to do what you need to do. Till I see you next time, I hope these tips are useful. I hope they've given you a bit of mojo, a bit of courage to go in there and speak to your medical professional. Before I say bye-bye, have you subscribed? Have you clicked on that red subscribe button down there? Yes, just like this one on the screen. And the notification bell. Yes, that's where you don't miss a thing. Thank you. Remember, if you found this useful, give me a thumbs up, share this video to your friends, share to your family, share. I always love to hear your comments, so leave your comments in the comment section below. And if there are any ideas, any topics, any areas, and your own opinion, please, I would very much love to hear from you. Leave it in the comment section below. I will also encourage you to check out these videos as they are on my screen now. Yes, just click on it and go on to watch some of my older, insightful videos. I'm sure you'll find them useful. Till I see you next time. So bye-bye.